trials. As we speak, it's just yesterday that our network, which the consortium for vaccine clinical trials, met and agreed on the need to design a protocol that will begin to look at some of these the vaccines, not trials, actually testing these vaccines in different settings, including the AstraZeneca. Again, the AstraZeneca study in South Africa, we believe that the more needs to be done to learn, to gain more insights into how that vaccine is working vis-a-vis that variant. So I think we will be working as a collective using our networks and the sites that we've established to facilitate that study. I think that will happen pretty quickly. We're hoping to start bringing together that network of the vaccine sites that we design to apply themselves to that protocol, common protocol. Second question about sequencing is, as I said multiple times, if you do not sequence, you will not find. So saying that if a country has not a sequence, of course, you cannot know if that the variants are in that country. So that is why the Pathogen Genomic Institute and the network that Africa CDC is promoting and coordinating is very important. That with the countries that do not have the capacity can work with us to generate enough sequences to understand the spread and extent of the virus in their country. In DRC, I remain very optimistic that we have better tools now in the theater of response for Ebola in DRC than ever before. As you know, there's now a licensed treatment and vaccines for against COVID-19, against Ebola in DRC. Ebola in general, not just Ebola in DRC. And these are all tools that were not there previously. Okay, so I think that we just need to do the basic things, which is what we call the barefoot epidemiology. That is to find the contacts and trace them where they are, and then of course do the ring vaccination. And for those that will be sick, I mean, you know that we now have the cocktails of antibodies that were developed in collaboration with Professor J.J. Muyembe. So the theater of response is richer than it was even a few years ago in DRC. So it's just the challenge of finding the people and conducting the ring vaccination is what will drive and determine how quickly we bring that outbreak to a conclusion.
Thank you very much, John. We move on now to a question about AstraZeneca vaccines. And this question is coming from Alex Winning, who is with the Reuters news agency. So he says, do the AstraZeneca trial results place AVAT's vaccine plan under threat, given that 100 million of the 270 million doses that have been secured are AstraZeneca doses? Is the Africa CDC looking to swap out AstraZeneca in its vaccine plan? In other words, are you looking to remove AstraZeneca from the Africa CDC vaccination plan? And also, are there many African Union member states that are seeking to sell or swap AstraZeneca doses?
So the answer there is that we are watching the situation in South Africa carefully, and also, as I said just now, that we will be conducting our own evaluations across multiple countries to see what the extent of the impact of that. So for now, our strategy is not to throw away 100 million vaccine doses, but rather target countries that, as we indicated in our recommendations, have not reported the case. I mean, cases of COVID, that specific variant. We are a continent of 55 member states. And all 55 member states are supposed to be part of the AVAC. And that means if we exclude those 7 countries or so that have reported that variant, you still have an extensive number of countries that those vaccines can benefit from those vaccines. So we will not be walking away from AstraZeneca vaccines at all. With respect to countries swapping those, I mean, again, countries have not, besides South Africa, I believe, and a few other countries, we have not yet seen countries acquire large doses of AstraZeneca vaccines that will require that they return them or they swap them. The 7 million vaccines that the MTN had supported through the 25 million donation that they gave were all targeting the AstraZeneca vaccine. And those vaccines will begin to be distributed in the coming 2 weeks or so. And we'll move ahead with that plan. And of course, make sure that we target countries that have not reported those variants. Again, we need to do this quickly and vaccinate quickly to arrest this the spread of this variant. So that plan will still move forward, and this is a good vaccine without the variant, and the variant will only impact if the variant is overwhelming in the country. So I think that is our recommendation on moving forward. Again, the 7 million doses of vaccines will target essentially for healthcare workers in all member states.
All right. Sarah Jerving with DEVEX has a very related question, and you've answered part of it. But she has the specific aspect where she says, are there any countries specifically that have told the Africa CDC that they no longer plan to roll out AstraZeneca vaccines?
The answer is no. We have not received any inquiries or concerns from member states that are not going to, have not expressed interest not to use the AstraZeneca vaccine. But we just don't know what the situation will be in the next coming days. So, but as of today, no member state has expressed any concerns with that.
All right. Sarah, good morning. I see you've raised your hand. Do you want to ask a different question, or has your issue been resolved?
A different question, please. Thank you.
Please go ahead.
Thank you. So just because there is no kind of minimal travel bans, won't all countries get the South Africa strain eventually? And would that mean that they would have to do multiple vaccination campaigns? And then kind of looking back to COVAX, since many of the countries were expecting the AstraZeneca vaccine in the coming months, does that mean delays in accessing vaccines through COVAX? Thank you.
No, I mean, if you look at the WHO guidance and our guidance, we're saying that countries that have not reported this, the variant should go ahead and continue to deploy the vaccines. And that will be our position. So if countries have placed those the orders from the COVAX, they should definitely move forward with that. Now, I just want to be very clear. Reporting a case or two in a country doesn't mean that that variant has overtaken the pandemic. I mean, because you really need to design these studies appropriately so that you can follow up using good epidemiological sampling to understand how it's changing and understand also the background, what was initially there, so that you can understand how this new variant is dominated. But if the variant is only dictated in a few individuals, then there's absolutely no cause why you cannot use the AstraZeneca vaccine. I think that distinction is very important, because the narrative cannot be that you say in country X, you tested thousands of samples, you found one case, and then you declare that country not eligible for use of the AstraZeneca vaccine. I think that would be a false narrative that is not what our recommendation is encouraging. So just to summarize, be sure we are absolutely clear on that. You need very appropriate epidemiologic studies where you follow up, you track the variant across over a given period of time to really see the changes. If you all recall that South Africa only could make that pronouncement because in October, they noticed some changes, and then they kept sequencing over an extended period of time to December, and then realized that this variant was taking over there. So it wasn't just a punctual thing that they pick up a few individuals and then make that determination. So designing the study appropriately will give us the right answer if the variant is predominant or is not predominant in a given country.
Thank you very much, John. Let's welcome Joe Foster. Joe, good morning. I believe you are from the German News Agency. Hello, good morning.
Yes.
Hello, Joe. Can you hear us?
Good morning. Can you hear me?
Yes, I can hear you now. Please go ahead with your question.
I think my connection is bad. I'm not sure if you're able to hear me.
Right now we can hear you, so please proceed. Okay, it looks
Great.
like Joe is having...
Thank you. So my connection hasn't been great this morning. Just a question of clarification that only the countries where the... Sorry, are you...
Please go ahead.
Okay, I'm sorry if this question has been asked already. My connection's a bit bad this morning. So Dr. Dekemgazong, you said earlier that the Africa CDC recommends that only those countries where the variant, the South African variant is dominant, should not proceed with the rollout of the AstraZeneca vaccine. So of the 7 countries that you mentioned that have detected this variant, can you say which ones of those in which country of those is this variant actually dominant? Thank you.
No, that's a very good question. That is what my previous comments were really focused on that we should be very careful in the way we interpret this. That if country X sequence, you take 10 samples, you sequence it, and you find the one with the variant there, it doesn't mean it's dominant there. So none of these countries that I indicated have systematic studies over time that shows that the variant is dominant, has changed over a given period of time. I think unless or until you do that and you follow up over time, you will not be very appropriate to characterize a country like dominant with that strain there. Again, a cross-sectional study in one time point, and you pick 1 or 2 variants, that doesn't say that the variant is dominant in that country. That is all I'll say on that. So for those countries that we are reporting, it just means that they did maybe a survey, one time point, pick the variant, and that's all you can say at that point. It's a photograph of what they saw at that given moment.
All right, thank you for that. We move on to a question that's coming from Lawrence Caramel from Le Monde. And Lawrence says, how many tests have been done during the last week in Africa?
The last week, just give you that number, we've conducted, as a continent, 800,770 new tests were conducted over the last week.
Thank you. And another question that you've probably already talked to is coming from Vinicius Assis from Brazil. And the question is, how many African countries have registered the 501YV2 variant of the coronavirus?
So I think 7 countries, as I indicated earlier, have reported that the new variant. Again, I know I'm repeating myself, just doing a cross-sectional survey and picking 1 or 2 samples that doesn't say that variant is predominant in that epidemic. The key word here is that variant predominant in that country. Is it driving the pandemic? So the 7 countries that we indicated, as stated earlier, have just reported. Besides South Africa, of those countries, we have not seen extensive data that shows that the pandemic in those countries is being overwhelmed by the new variant.
All right. Elizabeth Merab has written in, and she says that South Africa had also reported that the batch of first vaccine doses had a short expiry date of April 2021. What does it mean with regards to vigilance on the batches coming into the continent? And what should countries do to ensure that their doses have adequate expiry dates? And also the last question, what is the timeline for the expiry? So that's Elizabeth Merab from the Nation Africa in Kenya.
So I think we have to, this is not just a South African issue, it's what we have to all agree across the board that vaccines that are shipped anywhere should have an appropriate expiring date that will allow for this quick update. In as much as countries are very keen, and we are also very keen to make sure that vaccination occurs quickly. It will be prudent that expiration dates are extensive enough to allow for at least a couple of months for vaccination, given the logistics of putting in vaccination centers and reaching out to people. So I've not seen the specifics of the South Africa situation. That is what you just described. But we would strongly appeal that when vaccines are shipped to the continent, that the expiration dates are factored in. Expiration date meaning that the vaccine should have a good shelf life that will allow the logistics of rollout to occur.
Thank you. We have a question coming in from RFE in Paris, and it is from Daniel Finan. So Daniel says, what updates do you have on the AVAT facility? How many countries have signed up so far? And what are the details of the delivery of supplies?
So, very good question. The AVAC, as of early this week, I don't have the updates as of yesterday, but as of early this week, about 20 countries had expressed the interest of ordering. Where the expression means they submitted the forms that we sent out to them and details of what vaccines they wanted. And of that, of the 20 countries, they have expressed an interest to order about 200 and above 200 million doses. I don't have the specific number there, but it's in the range of above 200 million doses of vaccine. So I think that is going on very well. We'll continue to update it. I think we should maybe include that as part of the weekly briefing so that we are very specific with the number of countries that have expressed the interest to order the vaccine. Now, the expression of interest, I emphasize that also means they have to concretize and finalize the financial arrangements with the Afri-Exim Bank, and then the orders will be delivered. So that is all I can say for them. The AVAC platform, which in my view is very encouraging to see 20 countries already express strong interest of the order with specifics of what they want to order.
Thank you, John. We have another question coming from David Pilling from the Financial Times. And David says, you have said that the case fatality rate is higher in several African countries than the global median. Does this not merely reflect a relative lack of testing on the continent?
I think it reflects many things. I mean, there are a couple of things we have said over and over that we know about this pandemic, and the things that we don't know. I mean, about what we certainly know is that the testing has improved a lot. I don't have the specific numbers, but next week I would like to go into the details of the testing so that we see the test ratio, the test per case ratio have really increased a lot. Are we testing everybody? No, we are not definitely testing everybody because the sero surveys are showing us that people might have been exposed more than what we are actually reporting in terms of the number of the molecular assays, which is a gold standard for testing. With respect to the death, of course, are we counting all the deaths on the continent? No, we are definitely not counting all the deaths, especially in this. But is it massive deaths occurring in communities? I don't think not. Let me put it this way: we now know, at least at individual level, I would say most people on the continent do know somebody who has died of COVID during this second wave than it was in the first wave. So the death rate has actually increased a lot. Another possibility, what we are seeing is that hospitals are being overwhelmed due to our health systems that are fragile, and taking care of these patients is becoming difficult. And because of that, of course, people die because of basic care. Oxygen is also another factor to put in here. The lack of adequate supply of oxygen in many care centers is also a factor that, again, we've talked about it over and over, and the need to improve that and build partnerships to supply oxygen. So key factors here include overwhelming health system, lack of oxygen, and of course, whether we are reporting enough.
Thank you. Some of our colleagues have come in with follow-up questions. So we'll take those coming from Alexander Winning, and he is with Reuters. So he has come back with two more questions. He says, does the Africa CDC anticipate that the rollout of vaccines on the African continent will be delayed because of the uncertainty over the AstraZeneca vaccine? Then the second question, is the Africa CDC speaking to Johnson & Johnson about increasing the number of doses that it will receive from that company?
So in terms of delay, no, the delay vaccination would not occur. Countries will be, as I said earlier, the next 2 weeks or so, the AstraZeneca vaccines will start arriving the continent, especially those that were being purchased by the support from NTN. Those vaccines will continue. Are we in discussions with Johnson & Johnson? Yes. I mean, especially trying to get more doses from Johnson & Johnson as part of the AVAC efforts. I think that maybe the specifics have not been agreed on or nailed down, but the discussions are ongoing to have an increased number of some of the Johnson & Johnson vaccines.
All right. Paul Adepoju has two follow-up questions as well. And he says, has the number of African countries that have ordered for the COVID-19 vaccines on the Africa CDC platform increased since last week? I believe that you've already answered this. You said this week we are on 20, and last week I believe we were on 16.
Yeah.
So then he has a second question. What is the latest total number of countries, and how many doses of the respective vaccines have been ordered so far on that platform?
So as I said, Paul, and Wayne already addressed your part A of the question, which is has the number increased? Yes, and who knows, it may have even increased for this last few days. So I'll leave that at that, and then we hope to come back to that next week. So with the specific of each country, if that is of interest, we will plan to do that analysis for next week. As you can imagine, it's difficult for me to memorize the 20 countries that have placed the orders and which specific vaccines they place their orders in. But if that is of interest to this conversation, we'll prepare that for next week.
Thank you. We come back to Esther Nakazi. And she says, in terms of vaccine confidence, what is the Africa CDC doing to reassure Africa and Africans, especially at this moment, given the South African study?
So we are assuring Africans that these vaccines are safe. I mean, the vaccine confidence, let's be very clear that we do not mix two things, where we do not mix efficacy and safety. So all the vaccines that will be run through the continent through either COVAX or AVAX will be vaccines that are safe. Whether the vaccines end up being efficacious or not because of the variant is a separate question. I think, but we know from data that was published that the original findings suggested that these vaccines were efficacious. Okay, we should also be looking at a key parameter here: are these vaccines going to delay mortality and hospitalization? That is very, very important. If these vaccines, and even if they do not prevent infections, delay mortality or reduce mortality and hospitalization, that would be great. So I think that would be a huge plus going forward. Remember, these are first generation vaccines, and we'll continue to learn from the virus and develop new vaccines as companies are already doing. So I think we will continue to learn how we use these vaccines and how they perform.
Okay, we have someone who's coming in for the first time, and that is Rhoda Odiambo. I believe, Rhoda, you're with the BBC. Please go ahead with your question.
Hi, Wayne. Yes. My question is to Dr. Nkegasong, and just following up on clarity. So, Dr. John, you mentioned that the recommendations from the African Union conference is that countries that have reported a dominant number of the South African variant, the recommendation was that they should not introduce the Oxford vaccine. So my question is, what is the threshold of numbers that countries should be looking at? Because I know Mozambique reported quite a lot of cases from this variant.
So again, Rhoda, I want to be very clear that you cannot do a one-time cross-sectional survey and then you address that question. It really has to be over time so that you see the changes. How what was the initial variant or lineage, and then what is is this the variant taking over? I think unless until we see that kind of data, it will be very difficult to say that because we detected this variant out of some type of sampling to make that conclusion very early on. There are many methods of sampling that, just give you one example. If, for example, I did a sampling of a household, and then you don't control for whether that family you took samples from the same cluster of people, you may end up saying that virus predominates. But the key thing will be that virus was circulating within that household or that smaller community, and it will be difficult to extrapolate that to the entire community if this makes sense. So that is why systematic approach of studies is very important to teach us whether the virus is predominant or not. So it may end up family sharing virus, that same virus there, and then you report it as 7 cases there. So again, I really caution that we use appropriate design protocols to determine if the variant is predominant or not. I don't know that I can give you a threshold of whether if the variant is at a certain level, it is predominant or not. Only a prospective cohort follow-up sampling would tell us whether the sample that the variant has changed or has become predominant.
All right, thank you for that. We have a follow-up question from Daniel Finan of RFE. And Daniel says, besides funding from Afreximbank to the tune of $2 billion, where is the rest of the money to buy vaccines coming from?
So there are 3 sources of support for vaccines. And one is individual countries doing their own vaccine acquisitions. And we know that some countries are doing it bilaterally, Egypt, Morocco, Guinea, and I'm sure others. Second is through the World Bank, the COVAX facility, which is really a source of subsidized vaccines or say free of charge vaccines. And third, of course, is through the Africa Union platform, that is the AVAC. Maybe I should add the food. I said 3, but add the food. The World Bank has also as you know, make an announcement that 12 billion was on the table, not for Africa, but the whole world. And of that, about 4 to 5 billion is targeting Africa. The countries have to express that. Those are not grants, those are loans, okay? Both the Afri-Exim, the bank funds, as well as the World Bank funds. The World Bank funding is really also designed to enable countries to roll out vaccines. So it's not just acquiring vaccines, but also rolling out vaccines. So again, it's not a grant or a donation, but it's long-term loans.
I think let's go to our final set of questions for today. And they're coming from Nibasumba Emile. And Nibasumba is a journalist at Radio Publique Africaine from Burundi. And she has two questions. The first one, Burundi will not get COVID-19 vaccines for the first phase, but it is among the low-income countries. Did it not ask for the vaccine? And what really happened with Burundi? So those are two parts to the first question. Then the second question, can you please explain the whole process for it to be decided that the vaccine against COVID-19 is sent to a country like Burundi? I think what she's saying there is, please explain how the decision is made for vaccines to be sent to countries like Burundi.
So, very good question. I cannot address the specifics of what Burundi has done or not done. As you can imagine, that I'm not privileged to those negotiations at the country level. But the process for COVAX is simple. I mean, the countries are sovereign. They engage with Gavi. Again, COVAX is a mechanism that brings WHO, Gavi, and CEPI. CEPI is the Coalition for Epidemic Preparedness Innovation together. So they discuss directly with that facility in period. That is all they need to do. And then based on their level of where they are categorized as low income, middle income, or high income, they would have those discussions going forward there. So I think that's all I can tell you with that mechanism. With AVAC, is the same. The African Union mechanism is that we've shipped out all the materials that are required to countries. The forms have been sent to them. It's up to Burundi to go into the system and ask for their vaccines. And if you go into the amsp.africa, you actually can see the allocations of, and countries have access to that. They can see the allocations of how many vaccines are allocated to countries using very objective criteria, population size, maybe the pandemic and other factors there. We did this same exercise during the diagnostic. When we were having the diagnostic challenges, we arranged for the diagnostics, allocated them their quotas to countries, and in the countries were able to go in and acquire their diagnostics. It's the same process and mechanism for the vaccines allocation. So Burundi, in short, can go to Africa CDC platform and source for their vaccines. I don't know what they have done with COVAX. I'm not privileged to those in-country discussions.
Okay, thank you for that. We have run out of time, but I can see that, Sarah, you have your hand up. Can I encourage you, please, to just write that question into Neke on that WhatsApp number, +251 9455 0202310. Let me just give it to you again. +251 9455 02310. So please, Sarah, direct your question to Neke and he will be able to respond to you. But now it's time for us to have the last messages that Dr. John would want to leave with this press briefing. The main headline points that you want to give us, Dr. John.
So the couple of headline points, Winnie, is that we can prevent infections from this pandemic, given all the lessons and the tools that we probably had tools that we have at our disposition. And clearly that if you look at the trends that I just reported, it shows that we know how to prevent the infections, include, of course, that we continue to work with the community to improve and sustain the ability to wear masks, that we avoid large gatherings. Of course, if we deny the virus space to spread, the virus will not spread. And that's why we see the several countries are now bending the curve again during their second wave, and very nicely. And I really hope that next week we continue to have good reports over the last week. This is a tricky virus. We may come here next week and realize that we actually saw an upward trend. But I really hope that with the gains that we are making in that downward movement, essentially due to adherence to a good public health practice, will continue. I think that is the first case. In summary, let's go to war with what we have and not what we need. For the vaccine piece there, that vaccines are not a magic bullet. They will not be here anytime soon, meaning that in the next 1 to 2 months, that even if they are here, it will take time for the effect to get to effect of the vaccination to actually be felt in terms of decreasing number of infections and hospitalizations. So I think let's remain, they keep working hard. The way all of us are working, the WHO, Africa CDC, Africa Union, and others to get the vaccines to the, but again, discipline and adherence to public health measures should still be the gold standard for us to prevent this pandemic going forward. And lastly is that vaccines are safe. Okay, I will be the first person to get my vaccine shot if they were available. I have not yet had it just because we don't have it. And we are looking for vaccines to protect our frontline workers. So not just the healthcare workers, but like responders in the field. I mean, we are deploying Africa CDC, a large number of responders. Now we are actually in a difficult position to do that because of, excuse me, because of the infection. So we continue to work with or look for vaccines that can enable us support our frontline workers as well as healthcare workers. So I think those are the two key messages, Wayne, that I would like to leave this audience with.
Thank you very much, John. I think that will be a great confidence booster. The fact that you will be among the first ones to take the vaccine once it hits our shores here in Africa. Thank you very much for that. Colleagues, this is the end of our press briefing for today. But before we go, let me just inform Dr. John of a compliment that has come through from Vidomu Aka. And Vidomu simply wants to say, very good meeting with a lot of information. So that's a nice comment. Thank you for that, Vidomu. Colleagues, this is the end of our briefing for today, but we will be back with you as usual at 11 a.m. East African time next week on Thursday. Bye-bye for now.
Thank you. Bye-bye.